I'm Corey Walker. I'm one of the spine surgeons here at Cedars-Sinai as part of the Department of Neurosurgery. I'm here today to talk to you about some of the spine surgery procedures that we do and try and give you a better idea of when we do certain procedures and when they're indicated, and if so, what kind of procedures we do to help your pain and neurological symptoms. When patients come to see me, oftentimes they're presenting symptoms and concerns related to a compressed nerve or compression of their spinal cord. These types of symptoms can be resulting in weakness, numbness, tingling, pain, and trouble with their balance. When patients have symptoms related to nerve compression, the decision to perform surgery is often much easier. Because we know we want to prevent permanent neurological symptoms, our goal is to take the pressure off the nerves and or spinal cord. And this can happen in a variety of different ways depending on the way the patient presents, their age, and their specific cause of compression. As we age, the joints in the spine can lose their ability to resist compression, to bend and flex in certain positions, and altogether this can result in arthritic type pain as well, which can be referred to the location in the spine where it's happening. That is, if you're having arthritis in your neck, you can have neck pain, or in your low back, you can have low back pain. And this is another way that patients present to me. Additionally, these things can come together. So very commonly, patients will present with low back pain and symptoms of weakness or pain shooting down their legs, or neck pain and nerves being compressed causing pain or weakness or numbness or tingling in their arms. And so depending on where the pressure is on the nerves and where the arthritis is, patients can have various presentations, which makes the treatment of spinal disorders very complex but also very interesting. When patients present to me in the absence of severe neurological symptoms, oftentimes we can have them avoid surgery altogether. And this is accomplished through dedicated physical therapy, injections, anti-inflammatory medications, sometimes muscle relaxants, and oftentimes most people can avoid surgery altogether. Persistent symptoms often, though, do require surgery. For me, my first goal is to try and avoid surgery in all patients if possible. Again, if someone has neurological symptoms, it changes how we approach them, with severe neurological issues being an indication of performing surgery right away. If patients have subtle symptoms and we can try other things, but then they return to us with an inability to improve their symptoms with non-surgical means, we'll tend to consider the smallest procedure first. My specialty is minimally invasive spine surgery, so I try to use small tubes and a surgical microscope and x-rays and navigation, sometimes even robotics, in order to approach the spine by using these anatomical corridors that don't cut the muscles in and around the spine. Typically, if this happens, there's a nerve that's pressing on the spine. These yellow things are nerves. And what we can do is we can make small little holes in the bone around the nerves and the ligaments and take the pressure off of the spine, nerves, and or spinal cord themselves. These procedures tend to be non-permanent in that they don't affect the longevity of the spine typically, they don't affect the joints, and they don't have any impact on the levels above and below. Sometimes, however, this is not able to fix the problem, and so we need to consider something that's more significant. Oftentimes, we can have a problem with the discs in both the neck and the low back, even in the thoracic spine in the middle of the spine, and we have to replace the disc itself. This can happen in symptoms where the disc has collapsed completely and there's problems with the amount of ability of the spine to resist compression. And when we stand up and load and do our activities, pain can cause those symptoms to worsen. In younger patients and patients that we hope to preserve their mobility, we'll consider doing what's called a disc replacement. Total disc replacement, or arthroplasty, allows patients to preserve motion. This has multiple benefits, including taking off the pressure that can be transferred to the levels above and below the problem in the spine. That is, if we have a problem at this disc and we do something permanently to this disc, such as spinal fusion, where we get the bones to grow together, then it can transfer that pressure onto the level above and below. Sometimes that's required in cases where there's excessive motion, scoliosis, or problems otherwise that cannot be fixed with disc replacement alone, or in older patients where the degree of arthritis is too much to preserve motion at that segment. When we do consider motion preservation, we can often place an implant, such as this one here, that allows continued motion across the disc, and that's what we call a disc replacement or an arthroplasty. This can be particularly beneficial in younger patients who hope to maintain the movement in the spine and the specific bones and maintain the longevity of their spine. It's known that there can still be problems at the level above and below in arthroplasty, but the rates from our existing literature show that much less in these patients, and this can help prevent long-term problems come with known historical ways of doing spinal treatment and spinal surgeries. As we continue to progress and learn more about the spine, we're finding that it's more and more important to maintain motion in the spine and to preserve the longevity of the spine in whatever ways we can. Additionally, by using minimally invasive techniques, we can preserve the paraspinal muscles that support our spinal motion and keep us active and mobile as long as we can.